Orthomolecular medicine, orthomolecular psychiatry, probably two terms you may not have heard of, but basically these are terms that mean they're going to use natural substances or attempt to use natural substances to affect a response in a body. Either it's with psychiatry or it's a medical condition that you have that you want to address. But it's not endorsed by most of the medical community, but in a lot of ways it's semi-endorsed by most of them a little bit. Not as a complete science or wholeheartedly embraced, but even the medical community obliquely endorses this a little bit. But I have to state, though, that some of the studies and some of the opinions are so divergent that I personally came to the conclusion that somebody's lying. It's not a matter of it's an opinion, I disagree with you. It's like some people are saying one thing is completely wrong, and group of people is saying one thing that's totally the opposite is good. Now, actually, I want to give a couple examples of a couple of vitamins right here that you could say a lot of doctors realize that vitamin C can be helpful. It's necessary, like a smoker should take a little more vitamin C and has a little higher requirement for vitamin C than most people. But most doctors won't advocate mega vitamin C. Now, it was Linus Pauling that advocated mega vitamin C, but his work is actually predated by other people by a number of decades. Now, Linus Pauling was a two-time Nobel Peace Prize winner, and he was not a medical doctor, and some medical doctors criticize and say, well, he doesn't know because he got his Nobel Peace Prize in one of his prizes in chemistry, and he delved into another field and he feels like he knows. But I think his work is more backed up than just by his own endeavors or what was done by the Pauling Institute, but by other medical doctors. Another vitamin out there that you might see doctors prescribe for anemia or even give injections for is B12. So in a lot of ways, this orthomolecular medicine is at least semi-endorsed by most doctors. Semi-endorsed, let me put it that way, is use that kind of word. But the thing is, it's not going to the full 9 yards that the way the proponents of orthomolecular medicine would want it to be. Now, actually, I think this is a very, very important approach. I'm a layman, but I took this right off of Wikipedia just to give you like the straight facts. And actually, I'm going to point to a couple things that even Wikipedia leaves out, which they can't actually put everything in this article anyway. But it does state here in Wikipedia, and I emphasize this and highlighted it double, few medical or scientific experts support this approach. But the definition of orthomolecular medicine is also sometimes referred to as megavitamin approach, the megavitamin approach, or orthomolecular nutrition. So it's what Linus basically it's correcting the imbalances or deficiencies based on individuals' biochemistry. So they would test for your vitamin D levels, your vitamin E levels, your selenium levels, and adjust your your intake of vitamins based upon that approach. So the term orthomolecular was actually coined by Linus Pauling. But I want to state this. I'm not going to be able to cover all this stuff in this video because I've read many, 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 many books on this. And actually, I've come to the conclusion, in my mind, that even though pharmaceutical medicines are necessary, many, many times they aren't necessary. They are necessary in certain instances, but it's not as if, it's in my opinion as a layman, that they're not necessary all the time. In a lot of cases, in my opinion, from books I've read from medical doctors, I'm not talking about looking up on the latest alternative medicine blogs that somebody wrote. I'm talking about the work of medical doctors. Like, for instance, I looked up the work on vitamin C. I looked up Kleiner, Cathcart, Levy, medical doctors, but even preceded Kleiner, which actually started using mega vitamin C in the 40s. Now, Linus Pauling got the idea about mega vitamin C from somebody else because he realized it was in most animals, in most of the animal world, but it was something that we had to consume from our diet. Humans were a little bit unique, except for some primates and guinea pigs and a certain species of bat. And he started figuring out that possibly we don't really get the optimal levels of vitamin C that we should be. Now, I just want to state, if you look at this video and you're curious about more information, and this is not a plug to advertise for them or anything like that, but I would look at the Pauling Institute's websites, and because they go into a lot of different areas on not just vitamin C, but vitamin D, vitamin E, and a lot of different things where they can address different situations. Now, I don't think this type of video will be advertiser friendly to the conventional medical community. Maybe not, but what can I tell you? I'm trying to give you accurate information without being one of those people that scream there's a cure-all for this and that, because I don't say that type of stuff. I'm just trying to give you accurate information, and what my opinion is that some of the money that's behind pharmaceutical doesn't really like this approach, in my opinion, and that is really why partly it's crushed. But in my opinion, the term orthomolecular was coined by Linus Pauling to mean the right molecules in the right amounts. Ortho is meaning from the right. Proponents of orthomolecular medicine hold that the treatment must be based upon each individual's biochemistry. Now, this is actually a situation that I think is the right approach, because in today, with our vastly depleted soils out there, when you eat a balanced diet, you're not even getting all the trace elements like you used to, because of agriculture has become a big business where they produce foods on about a number of pounds or kilos that they sell, so they want to grow them as fast as possible. They're not actually as nutritiously dense as they used to be. And a lot of times too, if you look at some of these worldwide studies, you'll find that people that grew crops from near the glacier runoff of water, the water running off from glaciers, that contains a lot more trace elements. They might have a lot less incidence of cancers. They'll have a lot more longevity, a lot more vitality, because the nutrients are they're more. The soil is more nutrient dense, and these nutrients are found in higher quantities in the foods. Today's foods, fast grown produce, plus all the other things that are processed that we get in our supermarkets, we probably do have a lot of vitamin deficiencies. I think that's pretty much a given. And the reason we probably don't have, it's not that widespread, is because a lot of people are aware of taking vitamins. But I don't think people are actually getting the optimal dose, which probably requires what a lot of medical or scientific people would call mega dosing. Now, this is the method not endorsed by most of the scientific or medical community, but there are some bona fide doctors and scientists that do endorse this approach of taking mega vitamins. And you can see some of the best, I call them quote unquote health nuts, like Jack LaLanne. I mean, he died in his 90s, but when he was 70 years old, he was pulling 70 boats with his teeth or something in the water, swimming for 2 miles when he was 70 years old. He used to take, this handful of vitamins was nothing compared to what he used to take. So even though he died at age 93, I think his problem was he was actually lacking one nutrient. It turned out to be possibly K2, which caused some calcification in his heart. But otherwise, he probably would have lived maybe many years beyond that. But even so, at the age, I think it was 93 he lived to. I forgot what his age. Maybe it was close to 100. I'm confusing that with Linus Pauling, who died at 93. But the thing is, even so, it seems to improve the quality of life quite a bit. And the other thing is, a lot of times vitamins can actually help you reduce weight, and also other nutrients. Like coconut oil, for instance, a lot of times people talked about coconut oil. Coconut oil is a fat that actually goes to energy quicker than a carbohydrate. It's one of the fats that doesn't really get processed into fat so easily, and it gets burned up almost immediately because it's a medium chain triglyceride. Also, larger amounts of vitamin D have been known to help process fat quickly, more quickly. And I have another video out on that, but it's like, I don't want to get into the detailed process because I just want to give you a quick overlay on this. But there's a lot of different things that are involved in this type of orthomolecular medicine. Now, there's also orthomolecular psychiatry. Now, actually, this is one area I think it really should be applied to more than anything, because in the field of medicine, they're dealing with empirical measured scientific data on the body. In other words, they could say your blood pressure is, 120/70, or it's, 150/95, and they'll say, okay, that's too high. We need to give you a medicine to bring down that blood pressure. They might say your blood sugar is too high, or you're diabetic, and they'll give you a medicine for that, right? Or something wrong with your heart or whatever, that they can give you a medicine for that. In the field of psychiatry, it's almost like very difficult to make an evaluation based upon a person's behavior. This is one thing, and actually there's been a lot of criticism of psychiatry for that reason, because of you could go to like 6 different psychiatrists and they could say 6 different things about the same person. So it's not like they're measuring something exactly. They're making observations of your behavior or what your responses are, and then evaluating upon that. And it's like, it's very much opinionated, and they have their diagnostic codes manual that will make it look very official. But I see, in my opinion here, my layman's opinion, this is one area that this type of orthomolecular approach should really be applied, because, one of the things with the orthomolecular approach, which is megavitamins or other types of nutrients, it's not to do harm to the body. And a lot of these psychiatric drugs actually will mask symptoms. In other words, they're kind of stopping this behavior or stopping the person from acting this way or that way, or being too rambunctious in school or whatever. Yet, at the same time, they're kind of like putting a big wet dampener on that person's ability to think, and clouding their, mental cognition and creative thinking. So, it's got a bad side to it. Now, the other side of it with nutrition, or even megavitamins, if you want to say it that way, it's something that's not going to do harm. And actually, if you look back, if I just want to say something else in relating to both orthomolecular psychiatry and orthomolecular medicine, that in the last 10 years, I think they had maybe 10 or 12 possible deaths linked to megavitamins. If you compare that to pharmaceutical drugs, I think pharmaceutical drugs is like the number 3 killer, between doctor mistakes and actually patients taking too much, and is the number 3 killer in the United States. It's that bad. I mean, it's like when you're comparing megavitamin doses to other things. Now, there's certain megavitamins that are actually dangerous to take, but there's a lot of controversy in other ones that are more commonly like advocated, like say, for instance, by the Pauling Institute, like the megavitamin C. I heard things, with the kidney stones, and there's only one type of vitamin C I think that could be linked to kidney stones, and it's not very likely. It's ester C, because it's calcium exsorbate. It's not just plain ascorbic acid. It's not going to ever do that in a million years. It's the one that you see that says ester C. That has the calcium in it, but that's not even that much linked. But anyway, getting on to orthomolecular psychiatry, it's a use of orthomolecular medicine for mental illness. In other words, megavitamins and nutrition for mental illness. That's their approach. So it uses unorthodox forms of individualized testing and diagnosis to attempt to establish, for each patient, specific symptoms and claims to tailor the treatment accordingly. What I like about this, is because when you're doing it with nutrients, you're not causing the person any harm, and you're not making them addicted to anything. See, that's one of my biggest beefs with this psychiatry. Otherwise, I probably think I'd have a lot more respect for the psychiatric profession if they took this approach instead. But, well, anyway, this goes on to state that orthomolecular psychiatrists began with Abraham Hoffer and Osman in the 50s and was continued by Carl Pfeiffer of the Pfeiffer Treatment Center. Now, I want to point out that, you can also say it was done in, they'll say right here in Wikipedia, they also say the ideas behind this approach can be traced back to 1920s and 30s. Now, actually, that's true, and I'll tell you why. It's true because back in the 1920s, what they used to do for psychiatric patients, and also people that had epileptic fits, but it was also not just the ones with epileptic fits, but also people that had psychosis and other problems in their mind, was they would prescribe a high ketonic diet. The high ketonic diet, spelled with a K, not a C, okay? It's actually one of the main foods in that. It's foods, basically. High ketonic diet was coconut oil, but it was also like milk fat, butter, high-fat cheeses. But the one that actually the modified high ketonic diet is mainly coconut oil, because coconut oil contains 47% lauric acid. It's very, very, very high in producing, having the effect of increasing the ketones in the brain. Actually, it's been known to by medical personnel to reverse Alzheimer's. Coconut oil. So I mean, they knew about this even in the 20s. So I mean, it's like, they say the proponents say that their approach can be traced back to the 20s, but yes, that's a fact. It's not a fact. So and also in this article, again, in Wikipedia, it says Linus Pauling in 1968 used the term orthomolecular, which it's a good term. I personally think a lot of doctors, especially the psychiatric profession, ought to try this approach, but it's not lucrative for the pharmaceutical companies. Now, I also want to state right now, because I know what I'm saying right now is music to the ears of the people that are like into the old quote-unquote alternative medicine. You be aware that a lot of times these claims by these alternative medicine people are just out there. It's like it's got its uses, it's got its limits. It's not a bunch of garbage, where some people like that are strictly traditionally trained might look down upon it as. But then on the other side, there's a lot of exaggerations in the people that are, I guess, talking about this alternative medicine. And I'll tell you one thing: I never knowingly exaggerate anything on this channel, and I try to get all my information. Even though I'm not a medical doctor, I look very carefully at what medical doctors say. And I know they disagree with each other, but I can tell you one thing: I look very careful at what medical doctors say. I know there's some medical doctors that advocate these kind of approaches. They're not in the majority, but there's a lot of evidence to show, in my opinion, that they're truthful about it. But the thing is, what they're prescribing, for instance, through like mega vitamins, is not very good for the return on investment in the pharmaceutical industry, because you can't patent nature unless you're Monsanto. So anyway, Hoffer in the 1950s was the first major practitioner of this type of therapy, and he focused on using niacin. Now that's actually the main niacin, which is the true niacin, not the flush-free. And since it's got such a strong flush, you want to take actually what a lot of and I'm going to give you a real overview, because you're going to have to look through other studies on this, because I can't give this all out in a freaking quick video here. But actually, niacin was given to schizophrenic patients. Well, what they would do it was actually grams of it, but grams, like thousands of milligrams. But they would do very, very, very tiny doses during the day, like 100 milligrams here, 200 milligrams here. Because if you try to take 500 milligrams, even though I heard it's not harmful, you will get a very strong flush of almost like a burning sensation on your skin, and you will not like that. So it's not something you want to mess around with by just taking a lot of something. Actually, when the people did these studies, and I'm not telling you what to do, but I'm telling you is from this video, go to other research on this. You could see that a lot of times when they did these mega vitamin studies or using this orthomolecular approach, the smaller divided up doses were far more effective than, you know, several large doses. So in a lot of ways, it's a lot of work to do this approach because you got to remember to take this. But it's almost like, I guess, if you're taking it in smaller doses, it's almost like getting extra rich food like we used to get, right? You know, before it was mass produced and farms were not big corporations trying to produce food and up the production without, you know, looking at the exact nutrient quality of the food. So anyway, what he used was, back in the day, he used a task force. Well, basically, he used niacin to treat schizophrenia. Now, I'm going to tell you, he's not the only guy that did this, because there were studies up in, I think it was Sweden, that did this, and it worked. It was like, I think it was a 3-month-long study, and it was so much amount. I'm not going to even tell you what it is. I know what it is, but I don't want to feel like playing doctor here and giving exact measurements. But look it up. It was a few grams of it, but in divided up doses of niacin that cured the schizophrenia of like 80% of the patients inside of 3 months. But, you know, the question was, you know, if they continued the other 20%, maybe, you know, over the next 6 months or more, maybe they would have been cured too. Maybe there would have been a 100% cure rate. But they don't like that, because once you're cured, right? You're done, right? So anyway, the assertions by the proponents of orthomolecular psychiatry were rejected in 1973 by a panel of the American Psychiatric Association. But, you know, it's my opinion that they got to sell you pills, man. And, you know, I think a lot of this information I'm putting out on the internet is not very popular amongst some of the big bucks guys, but because vitamins are very cheap. And, you know, a lot of times I notice a lot of freaking high dollar vitamins out there that, you know, it is better to take the best naturally derived vitamins that are bioavailable. But, you know, a lot of times even some of the synthetic vitamins, you know, it's better than taking nothing. You know, sometimes people just don't want to bother with the expensive stuff. But and I realize a lot of times there's a whole other racket, money-making racket involved, even in the alternative quote-unquote medicine world, where you're trying to actually tell you vitamins cure this and cure that, and you got to take our brand with this in it and that in it, and it's made this way, and it costs 10 times as much. And, you know, I'm not here selling you nothing, okay? I'm just giving you a plain little fact that our foods today, in, you know, made in big corporate farming, are not anywhere near as nutritious as they used to be. We got a lot more processed foods. We're exposed to a lot more toxic elements in our daily life in our modern society. We don't get enough sunlight, so we don't get enough vitamin D. And we're probably short on a lot of stuff, and we probably do need to take this approach. And a lot of people are actually taking vitamins in the United States, and it's probably, I'm going to say probably, and I almost, in my mind it's definitely, but I'm going to say probably. In my mind, it's definitely. I think it is preventing a lot of diseases, even though there's a lot of problems with Americans' health in general. I think just the fact that they take more vitamins is actually preventing a lot of stuff. Now, I don't think this is actually totally advertiser friendly, especially for the psychiatric profession. I know I had something out about, what the hell you call it, the female Viagra, but I can tell you right now, actually, I looked at that study, you know, with the placebo, and I could see why some of the panel voted down that female quote-unquote Viagra pill, because it wasn't that conclusive to me. So in other words, the placebo worked too. But, you know, it's a matter of, you know, a lot of times a person is even depressed or whatever it is. If you put them out on the beach and they're by the waves, they're by the sunshine, and they're getting the good healing rays from the sun, they're hearing the birds, they're hearing the waves, you know, the birds are seagulls, you're walking on the sand, and even scientists will tell you when you're walking barefoot on the sand, it actually equalizes the the natural electrical charge you have in your body, and discharges, pent up, charges that you have in your body that could affect your physiological health, and it balances everything out. It's an approach that they don't take anymore. Actually, back in the day, they used to have, in the medical profession even, they used to call it solariums, where people with patients, they would put them out in the sun, and they would just kind of like make sure they get enough sunshine, and the sunshine would help heal them up, both in a psychiatric way and also in a physiological way. They don't take these kind of approaches. They have them all cooped up in a hospital without the sun, and you're not getting a natural sunlight through the window the way you would without the window, and they're just drugging them up with all kinds of medicine. And actually, there's a lot of protests now coming up because a lot of people are aware that psychiatry kills. It does. But I don't let against psychiatry. I just think they ought to go with this orthomolecular approach. The orthomolecular approach would be better, but not only for psychiatry, but also for medicine in general. Because I'm going to leave you with this thought. It's actually the vitamin C. I could say, well, let me put it this way. Let me leave you with this thought. Vitamin C and vitamin D, they should not be called vitamins. They should be called hormone C and hormone D. Hormone D is actually produced in our body when we are exposed to direct sunlight. And we get, in an hour's worth of sun, we get about, exposed to, like in a bathing suit during the midday, an hour's worth of sun during the summer, just an hour, will give you 20,000 international units worth. I don't know, the medical profession, many of them, depends. The majority of them will say 2,000 international units is the safe upper limit. I don't think so, and I'm doing something else myself, but whatever. Now, vitamin C, if you look in the animal world, which is almost every animal in across the entire planet, with the exception of humans, primates, guinea pigs, and one species of bat, they produce mega quantities of vitamin C in their body naturally, because it's a hormone. We used to have this capability eons ago, because we have all 4 genes, but one of them is dormant. Actually, there's a few people that have a slight capability of producing some vitamin C in their body, and they're immune to scurvy for that reason. And you know what's interesting about that? Those people seem to actually live longer, healthier, and even though they're doing all this stupid stuff that's unhealthy, they seem to have a deflection of whatever's hitting them, that they live long. And it may be because they produce the vitamin C in their own body. There's a few people that have some of this capability. And, there's doctors that tell you, some doctors, not all, but some doctors say that mega vitamin C can often stop the common cold right in its tracks. But what they're advocating, I don't want to even say what mega is, but, I have not seen where there's any kind of problem with this at all, and I've read all the medical literature, so I just want to say that. And it's also an absolute antivirus side, and it's also absolutely essential for your white blood cells. In other words, when you're sick, your white blood cells will need, just your white blood cells alone will need at least 6,000 milligrams, according to another doctor. So, I don't know why there's such a divergent opinions out there, and I can tell you one thing, there's another study out there by Harvard University. And I'll leave you with this. I guess this is another final thought, that there's another study out there by Harvard University, the best of the best, supposedly, right? And they'll tell you that a lot of there's mega vitamins will actually cause damage to your body. What's the truth? I know what my opinion of the truth is, but I just want to make you aware that there probably is a much better approach to medicine that we're taking today that'll bring down the cost and also bring down the healthcare crisis, quote unquote, of everything costing so much damn money to treat people. And I think this is the way. Orthomolecular approach. I mean, you really can't. I know some of the medical people try to poo-poo freaking Dr. Linus Pauling, saying, well, he was a chemist and he was very bright in his area. When he went over to the medical field, he doesn't really understand. And I'm like, yeah, sure, whatever. I'm not buying into that. Actually, I think this is a better approach. And it goes right back to the father of medicine, Hippocrates. He's, he says, "Let food be thy medicine, let medicine be thy food, and do no harm to the body." And considering the way foods are grown today, they're not as nutritionally dense as they used to be, so you probably do need to supplement. So anyway, just want to give you probably lengthy update on this subject, but take a look at the Pauling Institute, the Linus Pauling Institute, because there's a lot of wealth of information there, and I think that's one of the better ones because it is kind of hard to find this information. And do not trust people that are necessarily blogging this stuff or have vitamin commercials, and because they're selling something too. I'm not selling nothing. I'm just telling you, always had a keen interest in this type of area, and I think it's very legit and it's a very smart approach to take. And it's probably not going to be very friendly. This information is probably not going to be very friendly to the pharmaceutical community, but so be it. I wish they'd mend their ways.